We have a lot of patients who are of various ethnic backgrounds who have nostrils that they feel are a little bit wide or a little bit too flared and rounded. And so we want to talk a little bit about the approach we use to reducing nostrils.
Absolutely. I give Dr. Litner a lot of credit for this. You know, it's really important that you do an analysis of whether it's the nostrils themselves have just too much flare, meaning rounding, or is it the sill distance, the distance from the columella itself, the septal area in the middle, and the nostril insertion. Is the width too far? That's the sill distance.
A lot of people are afraid of this procedure. They've seen nostrils that look a little too over-tethered, over-shortened, and that look unnatural. When it's done properly, that should never be something you have to worry about. And that's really a function of the technique and the approach that's used. Where a lot of surgeons sometimes go a little astray as they rely too heavily on taking too much tissue from the curved part of the nostril itself. And if you're over-aggressive with that, that can bring the cut edge of the nostril back down to the cheek and make the nostril look too straight and triangular.
Absolutely. So if you look at nostril pictures, if you go on our gallery, what you'll see is it's really important when you bring the nostrils in, you want to retain a little bit of that flare, a little bit of the natural curve, and we often will combine some of that flare reduction, what's called a weir reduction, with some sill reduction, removing some of the tissue here, so that the nostril's not just getting tethered down, getting that pasted on look, but coming down and in, so you retain that natural curvature.